Hello, hello, and welcome to Hygiene Elevated Conversations and Innovations. Today, we're going to have a really great opportunity to talk to India Chance, and she is representing Ansell. India, thank you so much for joining us today on our podcast. I'm going to give you the floor a little bit. I want you to talk about yourself. We always love hearing hygienist's journey into dental hygiene. And how did your story translate into you working with Ansell?
Well, first off, thank you guys so much for having me. I'm excited to be here today, and I will just dive right into it. I've been a dental hygienist for a long time. I've been in dentistry about 30 years, and I originally was a business advertising major and didn't like it. My mom worked at a job where there was a dentist that was working with her at the health department, and he said, "You should tell your daughter to go become a hygienist and she'll love it. She can work part-time, make full-time money. It'll be amazing." And so I got a job as a dental assistant to see if I would like dentistry, fell in love with dentistry, and the rest is history. Went to school, became a hygienist. Early on in my hygiene career, I worked a lot in public health. So I'm a public health girl at heart. And I decided, I need to go back to school, finish my degree, because I graduated from community college. And I did a degree completion, finished my degree, and thought, I think I want to get out of the operatory. I think I'm done in the operatory. And so I just started obtaining certain jobs. I would temp clinically and get non-clinical positions part-time. And one of those positions, a friend of mine reached out and said, "India, I know a dentist. They need some help building their dental hygiene department, and you have great business acumen, and I think you'd be a great fit for them." And I'm like, "Sure, no problem." So I went in, and the biggest thing for me is all about education. Everybody's got to have education. And so I helped them build their dental hygiene department as well as a CE program as an employee benefit. And one of the things that I did was reach out to the OSHA trainer in my area. And she happened to be retiring and was like, "Hey, do you want to take my position?" And I'm like, "Okay, well, what is this all about? I've been in dentistry a long time. I didn't know we had to deal with OSHA and all of that." I would take infection control courses and things like that. And so this was back in 2017. And from there, I just began to build a business and have become very successful in that. And it's been great. And COVID, the silver lining for me is that my business exploded with COVID. And I began working with a lot more companies, infection control companies. And Ansell is one of them. And we happened to connect last year, really. And I'm a speaker and I'm a compliance consultant, and that's kind of what I do every day. I do this full time. I no longer do clinical except for if I'm volunteering at dental missions, but that is how I got to be on this amazing podcast today.
Okay, India, how have you possibly been in dentistry 30 years? Because did you start at birth? Because you look about 30 to me. And
Thank you. Thank you very much. Well, I'm not going to tell my age, but what I will say is I am qualified for AARPs, which I don't like to share too much, but I'm getting very excited about that because now I get discounts when we go out to eat and things like that because my husband is a year younger than me. So I'm like, I get the discount. You don't. So yeah.
It's a hard pill to swallow when you start getting the AARP in the
Yes, they're early bird specials. Yes, I know.
Oh, okay. Okay. I love your journey. And it is so truly just a journey in hygiene in how you just go from clinical to more and more things just by taking a step and getting outside of a comfort zone.
Absolutely.
Yeah. Totally. Congratulations on all of your accomplishments and where you're at now. So now you're kind of in like the ergonomic space with Ansell as well, correct?
Yes. So again, my focus is safety, workplace safety. In dentistry, we focus so much on patient safety and we forget about the clinicians a lot of times. And what I've noticed just in my journey with hygiene is we didn't really used to talk about ergonomics, practicing ergonomically safe. And now we are. Though I would say the last 5 to 7 years, you're seeing a lot more traction with that. And in support of that, you're seeing a lot more companies like Ansell bringing solutions to the industry so that we as clinicians can actually protect ourselves and maintain a safer working environment, as well as quality of life outside of the work, the job. Because anybody who's been in dentistry long enough, if you have not practiced ergonomically safe like myself, it does affect outside, of work, what you do and things like that when you're dealing with all of these aches and pains and any type of ergonomic injuries. So Ansell is one of those companies that's, right up there with several other companies that are really leading the charge to help clinicians to practice much more safely.
Oh, I love that. I feel like in my hygiene career, I was told so many times in school how important ergonomics was. They would tap you on the shoulder if you weren't sitting up straight, right? And then they put me in private practice and give me my first job. And I am like,
yeah,
like flipping all over the place. I'll stand up. I'm tipping over, like horrible ergonomics. And
yes.
I have had so much pain. And I felt like when they talked about pain, I was immune to it. I'm like, that's not me.
Yeah. We just learned to live with it, right? We learn that, the aches and pains are just part of the job. When you get out of school and you go into private practice, it's all about making sure the patient's happy. You know what I mean? Mm-hmm. It's all about making sure that that patient's comfortable. And we are really suffering to make sure that our patients are comfortable. It's not that we don't want them comfortable, but we don't want to injure ourselves in the process and that, affect us, outside of our job as well as career longevity. These injuries really, really do affect a lot of people. Again, the longer that you stay in dentistry, the more people you meet that are having issues. And so it is really nice to meet companies like Ansell that are going to look at this. They're going to see the pain points, see the issue, and then bring a solution for the problem. That's really what I like most about them.
I like what you guys had to say, and it made me think of something that I've not categorized ergonomics before. So there's active ergonomics, like Joffrey was saying, tapping you on the shoulder, get your posture right, quit chicken winging your injections.
Right.
But then there's products that are passively ergonomic, loops, but gloves. And I don't think that's something people think about with gloves. So can you kind of tell us, okay, how are these gloves ergonomic? How are they helping a clinician to have a better quality of life and extend their clinical life as well?
Well, I think you have to start with the materials that the gloves are made out of. The materials that a company like Ansell is using actually allows you, what it's called is a proprietary ergonomic design technology. And so it's using materials that are going to feel like skin. So they're going to fit a little bit better. They're going to allow for more flexibility. They also, what they've incorporated is different sizing. One of the biggest issues that when I walk into offices and we're talking about PPE and we're talking about, workplace safety and making sure that you have the proper glove size, you will find that a lot of clinicians will say, well, I'm too big for a small, but I'm too small for a medium, but I have to go with small because the medium is just too big and I don't feel safe. I feel like I can't pick up instruments or hold the handpiece properly. And so what Ansell has done to kind of address that is provide half sizes. So there are certain kind of features that they've offered to allow us to be able to work more comfortably in a situation where we're not the small bones and the tendons and the nerves and the muscles aren't constricted as we're doing all of those repetitive motions as hygienists, because, we're constantly doing the same thing over and over and over again. And over time that affects, your body. And it's not just your hand. It can affect, and radiate, the pain can radiate all the way up to, your neck and down your back. Obviously, because everything is connected, right? So the features that they have decided to incorporate really do help to address us being more comfortable as we're delivering those repetitive procedures or, let's say, long procedures?
India, one thing I did do is travel to students and do presentations. And one of the educators in just a sidebar conversation was telling me how they had a couple students fail their clinical boards, and they couldn't figure out why this one student was repetitively failing their board exam until they realized she was wearing the wrong size of gloves.
Yeah. Yeah, because when you are wearing an incorrect glove size, and most people are going to go smaller because, if you have a larger size glove, things, it's too loose. So most people are going to go smaller. And the problem and concern with that is you aren't able to flex your hand the way you need to in order to properly hold the instrument, which is going to affect your instrumentation. And so that in turn is going to affect the student that's trying to pass the board exam, right? When you are trying to angle that instrument properly, it's going to be too difficult because one, your hand can't move easily, as well as sometimes in my situation, because there didn't always used to be half sizes in gloves, it would be painful to hold the instrument correctly when I was wearing a glove that was too small, but that was the only glove size that I could use for me to feel comfortable with holding this sharp instrument in a patient's mouth. And so again, it goes back to the features that they have with their gloves. The material is thinner. I think that also, too, they have textured fingertips. That's very important. Again, these are all features that allow you to comfortably hold instruments and comfortably angle and move the instrument and adapt the instrument around the tooth structure in a way that's not only safer for the patient, but it's safer for me as the clinician because I'm the one that's actually holding that instrument constantly throughout the day, right? If that makes sense.
Absolutely. One of my first offices was like a corporation, and they were at a point where they were so conservative on the budget.
Yes.
And being so, we ran out of small gloves and couldn't order because the month wasn't over yet. And we had no choice but to use larger gloves, right? And then before the month even ended, the mediums were gone. And now we're having the whole team wear these large gloves, and they're like obviously way too big for my little hands. Sure. And I was doing a scaling and root planing. It was on the right side. I was injecting like an MSA. Clear as day, I could see my site I was going for. I slipped on my glove and poked myself in the finger.
Yeah.
Because I was wearing the wrong sized gloves.
Right. Yeah. So fun fact, it is federal law, and this is part of OSHA standards, bloodborne pathogen standard, that it is required by federal law. So that means every single state, every single dental setting, no matter what kind of dental setting, the employer is required to provide you with properly fitted PPE. So
I knew it.
You do not have to wait till the end of the month until the budget replenishes. You can certainly go and have that conversation and advocate for yourself as a hygienist, as a dental healthcare provider, and say, oh, by the way, not sure if you know, but per OSHA guidelines, it is required that I have properly fitted PPE. Now, you can't go in there and demand, the most expensive glove or whatever. But if you feel like there is a particular glove brand that fits you properly, that doesn't harm you, because remember, we have to think of skin conditions and things like that. And that's another feature that Ansell puts into their gloves to help with preventing dermatitis and things like that. So if you find a glove brand or any piece of PPE really that does not harm you and allows you to perform your duties, it's required by law that your employer has to provide that for you. Now, again, you have to work with them. You bring up this situation where you got an exposure, a needle stick exposure. I had a similar situation with one of my clients. He ran out of the glove brand. They couldn't get the gloves in. It's not that he didn't want to, but he just the shipping or whatever. And his assistant put on a medium glove and she was contouring. She picked up the high-speed handpiece, contoured the crown, the temp crown to place, and the extra glove material, because it was too big for her, got wrapped around the burr, and she lost control of the handpiece, and she actually drilled into her thumb and had to go to the emergency room. So there are major injuries that can happen when you are not wearing a glove, that the glove size that is right for you, right? And so it is so important. And I think that we need to have more conversation, because we talk a lot about loops, we talk about saddle stools, but now let's start talking more about ergonomically friendly PPE. I think we need more awareness around that, because it is a serious issue that we just deal with as dental hygienists. It's just kind of part of the job. We're like, oh, you've got a pain. Oh yeah, I've got wrist pain. Yeah, no big deal. Yeah. And so I think we have to have more conversations like this. So kudos to you guys for having a conversation.
Everybody listening, advocate for your right glove size. You deserve it. It's part of the rules.
That's right. Exactly.
I am fortunate. I had one office that I worked for a long time. He was a diva about his glove. This man he was a diva about his mirrors. I kid you not, 6 mirrors per procedure, and they were going to be clean, but provided all the things, and like one tiny scratch, trash it. So anyway, you can imagine the glove situation in our office. So not only was it ergonomic gloves, they were rights and lefts.
Right. Yes.
I had never, when I was in school, it was like latex or no latex. Like that was your option. And to come into a right and left situation, and like if you ever accidentally put those on the wrong hand, like it. You're like, what is happening? My hands are being held forced open. So I had never even considered the ergonomic aspect of gloves until I encountered that office. So, I'm sure that this is a field where, I don't want to say the possibilities are endless, but hand hygiene is critical, because this is where so much happens.
Oh, absolutely. I think that, clearly we need our hands in order to perform the dentistry, right? And so I feel like we need to have more focus and more care around our hand health. You mentioned hand hygiene. That's so important. It's the number one way to prevent the spread of infection. It's part of the CDC guidelines. It's part of OSHA standards, right? And so we are supposed to be performing hand hygiene. And with that, in conjunction with wearing gloves, you can kind of have issues between the amount of hand hygiene that you perform and then wearing a particular glove. So what I mean by that is, our skin tends to dry out a lot because we're performing all of this hand hygiene, right? We're using hand sanitizer, we're using soaps, and these products have drying ingredients, and we get a lot of dry skin, we get cracks and things like that. Putting on a glove that doesn't have materials that are sensitive for your skin can actually further damage your skin. And so it is important. Again, this is another feature that we need to be paying attention to, because when you have dry skin, when you have small openings in the skin, they're painful a lot of times. And that too can affect how you're going to move your hands, right? And then if you're putting a glove on that's going to exacerbate the situation, your hands aren't going to move properly. Which then in turn affects the dentistry that you're delivering. So again, I say that it's just all connected. It's kind of like a domino effect. But we do need to have more focus. We need to take better care of ourselves. And it's, one of the main areas that gets skipped over a lot in the CDC guidelines is dental healthcare provider safety. We talk about, the immunizations, but we're not really discussing pulling back the curtain on what we actually go through to make sure that our patients are having a comfortable dental visit. And it's time we start having this conversation.
That is spot on. When I was a hygiene student, I was buying super cheap gloves for myself. The school was supplying super cheap soaps and super cheap hand sanitizers. Mm-hmm. As a result of all those cheap products, I developed like an immune response where the backs of my hands would get you so irritated. I'd have like little red bumps all over the backs of my hands, and they were so itchy. Like I had to go to the dermatologist. I had to get some steroid cream. And even to this day, 10 years later, if I use a cheap product, that rash comes back. It is insane. That much, because in school we are constantly changing gloves and washing our hands. Like we're washing hand gurus in hygiene school. And I created a bad skin condition that has lived with me ever since.
Yeah. I mean, that's what I say when I mean it affects your quality of life. I mean, this goes beyond the operatory when you're talking about gloves that are not ergonomically designed, and when you're talking about the hand hygiene products and things like that. We do have to start paying more attention to this, because in the long run, it's affecting us, right? You're talking about how you're still dealing with this 10 years later. It costs money. You have to pay for the steroid cream. You have to go to the doctor visits. You have to, you know what I mean? And so again, like I say, it's just a domino effect. And one thing I always tell my practice owner clients, I'm like, hey, look, I understand that you have to fit within a budget, but think about this, how much it's going to cost you if that hygienist is not wearing an ergonomically correct glove and she develops or he develops carpal tunnel, or they develop trigger finger or something like that, where now they're out of work, right? They're workman's comp. That's going to cost you money. Now you're paying for a temp to come in and see those patients. So it just kind of the issue compounds, and we don't really look at the full picture. A lot of times my practice owners will say, they look at just the immediate cost. And I'm like, look at the long-term cost, what that's going to cost you. And for hygienists that come up to me and say, hey, look, I'm dealing with this, what do? I tell them the same thing. You have to look at the long-term cost. Is this going to affect you in the long run if you don't have a properly fitted glove? Are you going to be dealing with all these ergonomic issues later in life where you're going to have to potentially get a surgery? That's going to, that costs you something, right? Time, money, whatever, is this going to be something that's long-term that you can never get rid of? You have to start looking at these things so that we can potentially maybe prevent those. And again, it does go back to having companies like Ansell that are willing to bring solutions to the market to say, hey, we hear you, and here's what we're providing for you so that we can help you and support you as you deliver dentistry.
Incredible. I just don't feel like we hear enough about these awesome companies that are doing things for us on our behalf, because as hygienists, especially in today's day and age, we almost feel like our voice is muted a little bit. And so it is just empowering to hear that there are companies out there looking out for our best interest.
Yeah. And I think it's important that when you find a company, let's say you like the glove that Ansell makes. One of the gloves that I like is the Ultraform glove, and it's thin, it's soft, it allows for extra tactile sensitivity. And so when you find a glove like that, okay, it's important for you to do a little bit of research, because it might not be in the budget, or maybe it's a different brand, or whatever the case may be. And you might feel like, oh, I might get a little bit of pushback when I go to the dentist and say, hey, this is the glove I want. Here's why. Educate yourself, become educated around the product, why you need it, why it's going to help you, how it's going to benefit, how it's going to affect the dentistry, the delivery of dentistry, and look at your operatory as if you are a dental practice within a practice. I tell all my hygienists that. I'm like, you guys are practices within a practice. And so you have to look at everything. It's not just about your equipment. It's about your PPE. Like, it's about everything. And so you were just mentioning, Amanda, how your doctor was like a fanatic about, like, he wants the gloves that he wants. We need to be the same way. We are the other provider in the practice. And so we need to look at ourselves as such. Just because our name isn't on the shingle, right, doesn't mean that we don't have a very important role. And I just think it's about educating yourself, getting empowered, equipping yourself to have the conversation with the doc about, hey, this is the glove, this Ultraform glove by Ansell. This is what I need. The gloves that you have currently cause pain, they cause issues, or the sizing is not correct. This company, I've done a lot of research. This is the company that provides half sizes. This is going to allow me to comfortably deliver the dentistry that I need to. This is going to help. And you can just kind of explain. You'd be surprised how many dental practice owners do not know everything that we go through as hygienists to deliver the dentistry that they want us to deliver and that we need to for our patients. So it's important that we get more vocal, not in a mean way and not in a diva way, right? But in a way that's educated and competent. That's why I say make sure that you educate yourself about the product. You might even want to go a step further and say, hey, look, I've looked at the different supply companies. I've looked at the different companies that we buy our supplies from, and here's the pricing. And this is the company that's going to give us the best price. Employers appreciate that because it's a business that they're running, right? And so we do need to make sure that we are, educating ourselves around companies like Ansell so we know what's on the market for us.
Absolutely. I would say if there is a hygienist out there that wants to advocate for themselves and get Ansell gloves in their clinic, I am a huge guru about hygiene is a business within a business. And it's so powerful to understand the reports and know your own value and know what you are bringing to the table and be able to pull that out of your back pocket in a time where you're ready to implement a glove change and be like, look, this is who I am. This is what I bring. This is why you should give me the gloves that I need.
Yeah, exactly. And I think it's important that you're make sure you pay attention to the features when we're talking about you researching your gloves. Make sure that it has that ergoform technology. Make sure that it gives you the comfort. Make sure that they have the sizing that you need. You want it to be durable. You don't want to have cheap gloves. Okay. It costs a dentist more to have cheap gloves because we put them on and they break. They don't have that elasticity. You want features like a textured fingertip, because a textured fingertip is going to allow you to work safely in a wet environment. We're dealing with blood, we're dealing with saliva. Those textured fingertips allow you to grip the instrument more safely. So there's a lot of things to look at that I feel like, we need more conversations around so that as hygienists, we can know, because, to be honest, I didn't know before I got into infection control. I didn't know there were textured fingertips and why we needed that. I just thought a glove was a glove. And lo and behold, that is not the case, And so there are a lot of hygienists that, they're not, they take infection control because they need to renew their license. They're not paying attention to, all of the little intricacies like textured fingertips on the gloves. So I think it's important that you understand the equipment that you have to use and all the way down to the gloves. Very important.
100% true. And I think if we were to put out a poll and ask hygienists their glove size, we would hear a whole lot of medium and small. Yes. We would not get very many numbers.
Right. Yeah. Exactly. I think the average hygienist, I would say, is probably wearing the wrong size glove in the wrong brand. They need a different brand because that glove size doesn't fit them properly, but they're just dealing with it because that's what they're given. And so I think we need to get out of the mindset of just take what you're given. Of course, you don't want to be out here and you don't want to, cause tension and things like that. And if the glove fits you, great. But understand that there are other options. And if you're having an issue, you do want to look at a company like Ansell because of all of the different features that they offer. I mean, I talked about the textured fingertips. I talked about the glove that I like, the Ultraform, because it's thin, it's soft. It really does feel like your skin. You're able to have a lot more flexibility, right? But what about if you have skin sensitivities, like you were saying about, you get a rash and things like that. And so they actually have a glove for that. It reduces your allergy risk. It's called the Microflex Exceed, I believe. Yeah, that's the one. And so that glove is manufactured without accelerators. And so for low dermatitis potential, things like that. So what accelerators can do is encourage allergies. And so this particular glove model, the Microflex Exceed, this is made without accelerators. So it's actually going to reduce any type of chemical reactions or latex allergies or anything like that. Even though it's latex free, there are still people who are super sensitive to the different types of materials and chemicals that go into glove materials. And so finding a company like this who has the different options for you is really nice, because from one operatory to the next, everybody's dealing with something different with their body. Everybody's health history is different. Everybody's dealing with different conditions. And so it's nice to be able to have options. That's really the biggest thing.
Stop. If I could have a redo, I would be like, I would start with these gloves, because I told you about the rash, but it's gotten so bad sometimes I've had to miss work because the gloves were so irritating. I'm a very high producing hygienist, so that was a hit on their production for the month. That was a hit on my paycheck for the month. Can you imagine? Like, I see dollar signs for everybody involved. Like, this impact. And you had made a comment that if you have cheap gloves, you end up spending more in the long run because they break. And I've experienced for a whole batch of them, like you just put it on and it breaks. You just pull it out of the box and it already is broken. And like sometimes the whole box is defective.
And I think for dental practice owners, that's not necessarily something you're going to go tell the doc, right? You're just going to go get another box. The problem with that is, for the owner, is he spent money on that whole box and it doesn't even work, and he doesn't even know it. So money is just going out the door, and they are spending money. You know, these dentists are spending money on this cheap PPE because they think that they're saving money, when in actuality, you get what you pay for sometimes. And when it comes to gloves, that phrase really does apply, because I walk into a lot of offices. I'm also a state board inspector, and I walk into a lot of offices who have gotten in trouble. And when you look at their PPE, you know that where it's been purchased, it has not been purchased from a dental supply company. It's been purchased from Amazon or from another company. And you can see how thin it is. I've witnessed clinicians put the glove on and it breaks right in front of me. And it is just literally, you are wasting money and you are throwing money out the window. And so little changes like that really do save you money in the long run. And, you know, you just said it, you lost work, you lost production time. Like, it affects everybody that's involved. It affects the patients, because what if it's a situation where you're in a practice where you're so busy that if the patient has to be canceled, you can't get them in for another 3 months. Well, how does that affect the patient's outcome, right? Their clinical outcome, their health outcome, if they're not being seen in a timely manner because, you know, you're trying to manage perio disease, things like that. So this isn't just, you know, a one thing that gets affected. This is everything as a whole. And again, I go back to, it's a domino effect of who can be affected and the negative outcomes that can come from not having the right glove. It's really kind of mind-blowing, really, everything that's affected.
Well, I'm even thinking of, like, you know, career longevity, because I like nice things. I like nice sheets. I like soft clothing. Of course I want nice gloves, right? I just like nice things. But when we think about the hygiene burnout rate, when we think about career longevity, could something as simple as a nicer glove for your hygienist bring even more value to the practice, because they feel more valued, they're happier, they're more like I could just see just that bougie side of me coming out. Like, I love nice things. It makes me feel good. Like, let's make our providers feel good so that they can do good things for their patients.
Yeah, sure. I mean, there have been a lot of surveys and studies put out by companies that, you know, they collect data on employee retention. And a lot of those surveys and a lot of that data discusses when an employer provides a certain level of equipment, for instance, in dentistry, you know what I mean? When you provide a certain level, that encourages employee satisfaction. When employees are satisfied, they're going to stay. It also encourages career longevity, because using an ergonomically designed glove, the way that they're designed, it's really what they call purpose built. And so it's built to support the natural movements of hands, which reduces strain on the muscles during these repetitive motions and activities that we do. So think about that. Like if we are using products that and equipment that is reducing strain on us, how much more satisfied and less stressed out and less burned out are we going to be at the end of the day? Right. And the less, the more days that we have where we're satisfied, it does decrease the overall burnout. With hygiene, you're going to see hygienists that are in the clinical role longer, right? Because years ago, we used to see that hygienists would work 30, 40 years, right? But things are different now. We have insurances. We have to see more patients. There's more demands. We're being required, we have more education. We have to do more different types of procedures than what we did 30 years ago, right? And so that alone encourages burnout. So why would we want to contribute to that by wearing PPE that's going to have us in pain, right? And so it's little things like that employers can do to really encourage that employee satisfaction. And not only that, why wouldn't you want to take care of your employees? They're people. They're somebody's mom, dad, brother, sister, aunt, uncle. I mean, it's about humanity and supporting each other and taking care of each other, right? At the end of the day. So, that's just my little soapbox, but those are just my thoughts on that.
Excuse me, they're completely valid points, India. You bring that up, and it just makes me think of my practice that I used to work at. The gloves were just the tip of the iceberg. It's a practice that I worked at for 7 years, still technically work there. I moved out of state, but they fly me back occasionally, which is crazy.
Right.
But the other hygienist, she's been there 20 years now.
Yeah.
His office manager's been there 30 years. Like everybody's in the double digits. So you saying that, and I'm just like, yeah.
I mean, who would get on the airplane?
15, 20,
who would get on an airplane and go work for an office who bought cheap gloves? Nobody's doing that, right? Nobody's getting on an airplane to go to an office where you have to fight with them to get the PPE that by law you are required to have, and it's your right to have it so that it doesn't harm you, right? You have to fight with them to get high quality PPE. You're not getting on an airplane for that. You know what I mean? You're not even driving a mile down the street for that. And so, right? And so that's the biggest thing that I really try to coach my employers around, is making sure that you're looking at companies like an Ansell who provide high quality PPE so that everything else, so all the dominoes don't fall over, right? We can keep everything in line. You can have, you're protecting your employees. See, PPE has a dual role. We know it protects the patient, but it also protects us. And it's not just from a needle stick. It's not just from blood splatter. It's supposed to protect, it's not supposed to harm us when we wear it. And so that is really the key when you are looking at, the device of the glove, so no, I'm actually jealous of you, Amanda, that you worked in an office like that. I unfortunately never had the opportunity to work in an office where they were, very concerned about it. And it's unfortunate because I've temped in those offices, but I never had long-term positions. And I remember walking into those offices and being like, oh my God. But you're right. Everybody that worked in those types of offices had been there for so long. I was just kind of filling in because somebody was sick that day or something like that. But it wasn't that they needed anybody, because their employees would never leave.
Yeah, icing on the cake, they also provided loops for all clinical staff, assistants included.
Yeah.
It's wild.
That's the unicorn office.
I really love this conversation because Amanda and I are on two separate spectrums of our experience. Right. So anybody listening, they're going to relate to either one of us.
I mean, you have a rash, and she's getting on first class airline tickets. I mean,
I'm not even joking. First class. It is first class.
It's like the total extreme. Yeah.
standard of care, it bruises my ego to think I am below standard of care. Like I can't accept that at all. But so I'm thinking, high standards. That's where I don't want to be standard of care. I'm a high standard provider. I'm definitely not below, but standard even bothers me because I'm an overachiever. I want to be above standard of care. And I just feel like quality care pairs well with quality equipment. It just kind of like nice cheese and nice wine. Like it just makes sense.
Yeah, it does. And I think that dental hygienists have to get more comfortable with having these conversations with their docs in a way that is going to be professional, is not going to be offensive. The in my experience, I've seen a lot of hygienists who do not advocate in a way that's going to get the results that they want. The way that they do it is sometimes not professional. Sometimes you're not equipped enough to have the conversation. So the language that you're using is ineffective. And so I think it's important that we educate ourselves on going back to who are the companies that are providing the high level quality equipment, like an Ansell who's providing high level, quality gloves. Educate yourself around their products. Understand, why they are doing what they're doing, and then take that information back to the doc. Don't do it in passing. Don't do it in front of everybody. Don't do it, on a lunch break. Schedule a time to sit down with your doc, 10 minutes, 15 minutes. Doesn't have to be long, right after work. Doc, hey, I'd like to chat with you about something really quick. If you've got about 10 minutes after work, it would be great. No distractions. There's no patients that he or she has to run and check and things like that. And just say, look, I've been having some issues. Be truthful, be honest. Nobody can argue with the truth. Listen, I'm having a real bad issue with these gloves. I have to perform hand hygiene. I got to wash my hands. I got to use hand sanitizer, and I'm putting on these gloves, and these gloves are really irritating my skin. I'm dealing with rashes. I'm not trying to complain, but I do need to advocate for myself because it's harming me. And not to mention, as an employee, it's part of, my right to be able to have something that doesn't harm me. And so I found these gloves, and I know we have a budget, but what can we do to make this happen? And collaborate with your employer. That's really the thing. We've got to advocate for ourselves and then come with solutions and understand their position, and then work on collaboration instead of just being and demanding. Like, this is what I'm owed this because OSHA said it. No, yes, that's true. But you get more, my mom used to say, obviously you get more with honey than with vinegar. And so it's a way that you present it. And I think more docs would be more interested and more open if we approach it from that perspective. And it just really, I feel like it just goes back to just educating ourselves even more around, what we have access to.
Mm-hmm. India, that is beautiful advice. So any hygienist who is nervous about bringing up the conversation, just, I'm think about how you deliver your treatment plans to your patient. Yeah. You have set the stage, you've set the tone, you're the professional. Use that same confidence, that same mindset when you're talking to your doctor about upgrading the gloves.
Yeah,
I love
absolutely.
that. India, your insight is just worth so much. I just can't thank you enough for joining us today. This has been just a beautiful episode. It's so inspiring. Ansell is a wonderful, wonderful company, and I just love what you guys are doing. And thank you for representing them today. And just thank you so much for the bottom of my heart.
You're welcome. Thank you guys so much for having me. And this was great. You guys are wonderful hosts. I appreciate it.
Thank you.
You are a wonderful guest. So would you like to share any closing thoughts or anything that you want us to know about Ansell specifically as a company before we jump off?
Yeah, I think, they do a great job at really listening to the dental health care provider. They've heard our pain points. They've provided features in their gloves that really make sense. And I think it's worth checking them out. They tend to go to a lot of the different dental hygiene conferences and things like that, but certainly you can visit their website. They have tons of information on their website around ergonomically designed gloves and the importance of it and the different types of features that you should look for. So if you want more information about that, definitely check them out. And then certainly, don't forget about us here at Learn to Prevent. Check us out. We're on social media and stuff. And we talk about this. We're going to be launching a YouTube channel this year to talk about these types of things and saying, hey, this is what you look for when you're trying to change your gloves and things like that. So stay tuned for that from us.
Love it. Thank you. Love it. What a beautiful episode. All right, it is 9 on the dot, and we know